We will talk about liver functions and liver tests, how we can measure if liver is functioning well and normal. And let's start with main functions of liver. Liver is largest internal organ in our body, and it's also largest gland. It means it produces something. It produces bile. Bile is a greenish yellowish juice which is important for digestion and absorption of fats. So when we eat fat, this fat needs to digest it and absorbed by our body, and for this bile, which is produced by liver, is crucial. Another important function of liver is metabolism, and when we say metabolism, we usually mean that liver converts one substance to another substance. For example, when we eat, in our blood glucose level rises, and our liver converts this glucose into glycogen and stores it. And when we fast and we have no glucose or less glucose in our blood, our liver converts back glycogen into glucose again. So our liver converts glucose to glycogen and opposite, glycogen to glucose, and we have constant flow of this energy. It's metabolism. When we're eating, we store this glycogen. When we're fasting, we have this stored glycogen to use as an energy. Also, if we eat a lot, our liver converts glucose into fats. That's why we gain weight. If you eat a lot of bread is enough, you will gain weight, because our liver will convert glucose into fat. Also, liver is crucial for fat metabolism. It converts fat to cholesterol. Also, it's important to protein metabolism. It creates protein from amino acids. Also, it removes amino groups from amino acids, and this amino group are toxic for our body, and liver detoxifies it also and converts as a urea, and urea is excreted from kidneys. So here is another important function of liver also. It's detoxification. Liver detoxifies harmful compounds in our body. For example, alcohol, or when we drink drugs, liver detoxifies them. Now let's say, what is the most common disease of liver? Most common is non-alcoholic fatty liver, which means when we're eating a lot and we gain weight, first place where this fat is deposited is liver, and liver becomes fatty. It is called non-alcoholic fatty liver, and it affects obese people, and obesity is number one risk factor for it, and 25% of general population are affected of non-alcoholic fatty liver. Another important and common disease is viral infection, such as hepatitis A, hepatitis B, hepatitis C. They are all viral infections of liver. It's common also, especially hepatitis B is very common, and alcoholic liver disease is common among alcoholic persons. Now let's say tests of liver. Most commonly used test to evaluate liver function is ALT, or alanine aminotransferase. It's enzyme, and it's produced in liver cells, and if liver cell is damaged, this alanine aminotransferase is released in the blood and its level is increased. So if ALT is increased, it indicates liver damage and liver inflammation. Also, it's frequently measured alongside with AST. AST is aspartate aminotransferase. It's not specific for liver, but in combination with ALT, it's also informative and indicates liver damage. Important test is bilirubin test. Also, when person is has jaundice, yellowing of the skin and eyes, and we have liver dysfunction, frequently bilirubin level is increased also. And of course bilirubin level can be increased before these symptoms occur also. Albumin test is important also because our liver produces albumin, and if albumin level is decreased, it means that our liver does not functioning normal because we have albumin deficiency, and it can be sign of chronic liver disease or malnutrition. Another test is prothrombin time, and prothrombin time is also used to evaluate liver function because extended period of prothrombin time means that our liver is unable to synthesize prothrombin factors, which are crucial for blood clotting, and blood clotting factors deficient we have, it means liver is unable to synthesize them. And among imaging tests, ultrasound is most important because it's accessible, it's cheaper, it's very informative. Via ultrasound you can find out fatty deposits in the liver, cirrhosis, obstruction, tumor, cysts. But CT scan and MRI are more informative, but they are expensive. They are also time consuming. For example, MRI, it's not comfortable for patients. In case of CT scan, patient gets radiation. It's also another side effect of this test. So most popular and most widely used is ultrasound. Of course, if needed, CT scan and MRI also possible. And biopsy, if we need to take sample from liver tissue to examine it under microscope, biopsy also used. That's all I wanted to say. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.